Is no one talking about the side effects you can have from chemo that affect your hoo-ha and how you should properly take care of your vaginal perineum area? This is something the doctor should tell you, right? I was diagnosed with stage 2 breast cancer and I'm about to start chemo. I was looking into all the side effects, which are numerous. They might as well tell you what you should not expect. So individualized, so not everyone goes through this, but enough people told me and I saw enough in this Reddit thread that I think we should talk about it. When chemo is coming out of your body the first 48 to 72 hours, it can burn you while you pee. This is what I'm getting from everyone's experiences. You should get a peri bottle. A peri bottle is a kind of upside down squirt bottle. If you have a bidet, even better. As soon as you go to the bathroom, if you are a vagina having person, it's gonna go everywhere. So you wanna spray that whole area down. Thing that is down there should get flushed. And maybe get some wipes. I like these honey pot aluminum wipes. I have some in my TikTok shop so you can see what it is, but you basically want to just clean yourself very well after you urinate for the first few days. So while the chemo is processing out of your body, it doesn't cause additional side effects such as burning. This person in the Reddit threads that they experienced labial changes, burning, peeling, blistering. Most of you said that the blistering wasn't an issue for you, so take it as a grain of salt that this could happen. It can be affected by the chemo itself because the chemo will lower your estrogen and progesterone level, and this can cause some menopause symptoms, which is GSM, genital urinary symptoms of menopause. This includes vaginal atrophy, in which the tissue of your vagina all shrink down. You can have a lot of dryness. There can be a lot of issues just in general with your body in general. I know that people have talked about cystitis, infections. You might feel like you have a UTI. Another thing you can do is moisturize. After you wipe everything clean, use Vaseline to just keep everything moist down there. I have the Mama Medicine balm. Different options in my TikTok shop or my Amazon wish list in my bio that you can take a look at that have been suggested to me. The thing that we should talk about is the use of topical estrogen in a hormone-positive breast cancer patient. ASCO is the largest cancer conference held every year in June. New research that shows that there is no increased recurrence of breast cancer in patients who have hormone-positive breast cancer like I do if they use just topical vaginal estrogen. Typically, the estradiol cream acts to help those tissues stay healthy. Lack of estrogen in those tissues can cause deterioration in quality of the skin. It can become real thin. You can have shrinkage, and this can cause further problems down the line. Of course, this is something you should talk with your oncologist about. The American College of Gynecologists did put out guidance in this year's ASCO conference that are allowing the use and suggestion to patients that they can use topical estrogen only. When you're facing chemo and you're thinking about all the protective things you need to do to your body, don't forget about your parts down there.